Good evening. Thank you for watching Derek Jones Facial Plastic Surgery Show. I'm your host, Andrea Housen, and I'm here with double board certified facial plastic and reconstructive surgeon and otolaryngologist, Dr. Derek Jones, and our special guest, Lindsay Terry, who is gracious enough to come on the show and talk to us about her surgical experience. Hi, guys.
Hello.
Thanks so much for coming on with us. In case you're watching, we are taping from the new Blab TV studios. And we have this great virtual set behind us, which is where just so happens to be the OR3 at the Medical Center Clinic, which is where Lindsay was about a year ago. And I was here a few times myself in the OR3.
Mm-hmm.
Yeah. Thank you, Dr. Jones.
Yeah, absolutely. We're going to talk a little bit about where we're going to be the next month or three, and then we're going to come back and talk to Lindsay and look at her pictures and everything like that. So let's go through this quickly with our PowerPoint and talk about where we're going to be. So save these upcoming dates. Well, we're in Gulf Breeze every Friday, so come and see us in Gulf Breeze on Fridays. You'll really love our space there. This is our front. It's right next to Baskin Robbins, 207 Gulf Breeze Parkway. So you can see all the names on the door and everything. So it's, again, right next to Baskin Robbins, right over the bridge. Very convenient for patients. That's our office lobby and everything. So come see us there on Fridays. We do go to some of the salons around town, and we're going to be at Result on August 26th. So come see us there.
Yeah. We'll be there from 9 to noon. We do injectable appointments there, Botox, all the dermal fillers. We can also do a consult there. So you can call them or call us. And then in September, we'll be at Penton House. It's a new location that we're going to in Pace, Highway 90. Once again, we'll do injectable appointments, consults, and you can call them at the number on the screen. That's 850-484, actually that's us, 484-3223, 484-FACE actually, and you can always get in touch with me and I'll get you scheduled.
Yeah, and the Pace location, we have gone there a couple of times. We really like going there. It's very convenient for patients, and we have a really nice following in Pace.
We do. And then we're going to be in East Hill, the heart of East Hill at Chastain Salon, on Wednesday, October 28th from 9 to noon. You can call them at 850-435-9935 to schedule. And you can always get in touch with me at 484-FACE. That's 484-3223 to schedule. You can always like us on Facebook. I try not to inundate the feed with too much, but you can see where we're going to be around town. We also put specials on there as well. So make sure to follow us. And you can also call me and get on our email list, and I can send the email blast so you know where we're going to be as well.
Yeah, so if you have any questions, either check us out on Facebook, give us a call, and get in touch with Andrea. 484-FACE, 484-3223 is our number. You can always get a hold of us and find out what's going on or schedule a consult, that kind of thing. We're going to talk a little bit about rhinoplasty today and about nasal surgery kind of in general when we talked to Lindsay, because she had some nasal breathing issues and also some cosmetic concerns, and we addressed all of those things surgically, and we're going to show her pictures and talk a little bit about it. But first, I think let's talk a little bit about your journey here.
Yeah, we'll take it away from the PowerPoint, but how did you hear about Dr. Jones, or how did you know about him?
I was referred to Dr. Jones by another local doctor who no longer did the rhinoplasties, and he came highly recommended. He just sang praises about him, and he made me feel really confident because, plastic surgery is very nerve-wracking.
Yeah.
So then, of course, I did my research and saw his wonderful reviews. So I felt confident, especially after I met you.
Yeah.
I felt very comfortable and confident, and you took your time and really got to know what I was expecting, what I wanted, and
Right.
we really appreciated our consultation.
Yeah, quite a few consultations too. One in California and then
I did.
here.
Yeah, that did not go as well.
It's so important to get multiple consultations to just make sure it's the right fit, and
Yeah.
it is very important. And just make sure that your surgeon is board certified. So in Dr. Jones's case, he's double board certified.
Yeah.
So, and if you wanted to touch on that, Dr. Jones, you could. Or...
Well, ENT and facial plastics, and I think that's especially with rhinoplasty, that's where it all comes together with the functional part, the cosmetic part, and I think that's important, and that's what we do, and I think it's board certification is important. There are some processes that people need to go through before you can become board certified and maintain board certification. So I do think that's very important. And yeah.
Yeah, and in Lindsay's case, it was a septonasal reconstruction to help the functionality of the nose, and also a cosmetic rhinoplasty. And we will be showing the beautiful before and after results here in a few moments.
Yeah. We can go ahead and show pictures.
Wonderful.
Let's just go ahead, and we're going to show the before and afters. So this is her picture, on the left side is before, and the issues were, you had trouble breathing through your nose, right? Yeah. And also your nose was a little bit crooked. It was
A lot crooked.
a lot crooked. It was kind of thin. It wasn't well supported. It tended to collapse some, and we'll see some pictures of that. It just wasn't. It didn't work very well, and it didn't look as good as we wanted it to anyway. So this is the before, and you can see it's more symmetric, better supported, more better, well balanced, and that kind of thing in the after pictures. This is just looking down, and you can see, how crooked it was before, and it is much, much better. I do tell patients a lot of times we can't really promise a perfectly straight nose, and I wouldn't say that her nose is perfectly straight right now, but it is markedly improved, much better overall contour of the nose, and much better supported, like I said, so it doesn't tend to want to collapse. And I think the biggest thing is, I think it looks normal, so people don't really notice your nose that much.
And I don't feel self-conscious, which is very life-changing for me.
Right. And that's great to hear, because really, people don't usually notice noses for a good reason. If you notice somebody's nose, it's because it doesn't look right. And so we don't want people to notice your nose. We don't want you to feel self-conscious about it. And I'm so glad that you don't now. The other things, had a little bit of a hump on the bridge of the nose, minor things like the skin between the nostrils, that tissue and that part of the nose tended to hang down a little bit more before, and the tip of the nose was really pinched and really, again, not well supported. So you can see a little bit of the hump on the bridge of the nose there, and we took that hump down, rotated the tip of the nose up just a little bit, and added a lot of support to the lower 2/3 of the nose, which is the cartilage part of the nose. And if you look here, you can see, again, a little bit of the bridge of the nose being straighter. When you have a hump on the nose, it tends to distract from the eyes. So, that it always helps to, especially in women, to have a little bit straighter or even a little bit of a concave type nose. And again, the tip of the nose, a lot of refinement in the tip of the nose as well. You can see the profile here. Again, taking the hump down, some refinement in the tip, and just a nicer overall profile. And then the base view of the nose that we take, you can see on the left side how the nostrils are asymmetric. They're very narrow, and then when she would sniff in, you can see on that left side she would have collapse, and you can see how much collapse she had, especially on her left nostril. You can see that there was collapse, but asymmetry, small nostrils that were asymmetric and not very well supported. And then after, you can see how there's improvement in the symmetry, and both nostrils are a little bit larger and a little more open than they were before. So that was a lot of the functional part of it was adding a lot of support, really improving the nasal airflow, both from the inside part, the septum, the turbinates, doing that work to help breathe better through the nose, but then also fixing the outside of the nose to add more support, make sure it didn't collapse like it was before, and then working on the finer points of the cosmetic part. So, but I think overall, I think from where we started to where we are right now, a really nice result. And some of the more challenging noses that I do, like your nose is a little more challenged, there's a lot of things going on with it, are some of the ones that I'm most proud of, because it does take they're hard to do. And
It was a long surgery.
yeah, it's involved. There's a lot of little parts in the nose, and putting them all back together, does take some time, and but we take our time.
That's something I appreciate.
Yeah.
That's what I appreciate about you so much.
Yeah.
Is I know you take your time with your patients. And
Yeah.
I love that about you.
Yep, and really try to get the best result that we can. So.
Well, I think we're about to take a break, so please stay tuned. We'll show the pictures again, and we'll talk a little bit more with Lindsay. Many who consider facial plastic surgery are concerned their results will look unnatural. But with over 20 years of serving the Pensacola community, his thousands of satisfied patients have made Dr. Derek Jones a trusted reconstructive and facial plastic surgeon known for industry-leading results that look natural. Call 850-484-FACE to schedule a consultation at one of our locations in Pensacola and Gulf Breeze.
I'm Dr. Derek Jones. Trust your face to a facial plastic surgeon.
Hey everybody, I'm Eric Bramer.
And I'm Charlie Hobart.
You can tune in Fridays at 5:30 on Blab TV for Wahoos Weekly, your weekly in-depth look at the Pensacola Blue Wahoos on the field and off.
We'll be talking to players and highlighting initiatives in the community that make Pensacola so special.
And when the Blue Wahoos are here at home, it leads right into live game coverage from Blue Wahoo Stadium. That's Wahoos Weekly, Fridays at 5:30
on Blab TV.
Fostering a pet for a friend or neighbor can keep families together. Learn more at petsandpeopletogether.org.
Imagine a new kind of hearing experience that lets you hear more of everything. ReSound Lynx, the world's smartest hearing aid.
It's baseball season. From heart-stopping plays to legendary victories, this is baseball at its finest. Grab your seat, bring your energy, and witness greatness live. Don't just watch it, feel it. The Pensacola Blue Wahoos are back, and you can watch Pensacola Blue Wahoos home games live on Fridays and Saturdays, only on Blab TV. Love the Blue Wahoos but can't watch? Get your tickets now.
I'm Dr. Mark Lees with Mark Lees Skincare Incorporated.
I've been in the business for 4 decades. I've seen tons of Dr. Jones' work. Dr. Jones actually worked on a really good friend of mine, took 15 years off his face. It was just amazing. So it was really, today is the day. I got to call Dr. Jones. My only regret in having my work done was the fact that I didn't have it done about 3 years earlier.
I'm Dr. Derek Jones. Trust your face to a facial plastic surgeon.
And we're back. Derek Jones Facial Plastic Surgery Show. In case you missed it, we've been talking with Lindsay Terry about her surgical experience with us. Dr. Derek Jones, double board certified facial plastic and reconstructive surgeon. And we were showing her beautiful before and after photos and we're actually just going to talk a little bit with Lindsay about her experience. Did you have a nasal injury, or was it hereditary?
No, I when I was 6, I fell out of my bunk bed,
Oh, wow.
the top bunk, and my dresser broke my fall.
Oh, my goodness.
And yeah, it was pretty bad break, and we did not go to the hospital. So I think that's why things settled so weird, and it was so challenging for you. But
Yeah.
yes, it was an injury.
So, Dr. Jones, when I know you say with girls, you want to wait till they're fully developed, about 14.
Yeah, I usually wait till about 14, 15 in girls.
So if there is a injury, you still have to kind of wait.
It depends a little bit. I mean, sometimes there are things that can be done right away to just try to reset the nose. I mean, that kind of thing we'll call a close reduction of nasal fractures, that kind of thing. But sometimes, depending on what the injuries are, we have to just give it some time and let things heal and then wait until the nose grows. I think part of the issue in her case was, her nose grew crooked. Like, it was crooked, but then as she grew, it grew crooked. And that's a lot of times the challenge, is that when things grow crooked like that, everything has grown that way. I mean, all the skin has grown that way, all the cartilage, all the soft tissue, everything has grown that way. And a lot of the changes that we make are going to make a really big improvement, and we'll show the pictures and you can see the type of improvement that we make. But again, having grown that way for so long, that's what makes it challenging. That's what makes it where it's hard to get it perfect, but that's okay. I mean, very, very good is still very, very good.
I don't know if you remember me telling you that if we got at least 50%, I would be happy.
Yeah,
and
yeah.
I would say we got way more. I would say like 80%.
+%. Yeah, I agree. I think and if you look at the functional side of it, that's made such a huge difference too.
Yeah, I can breathe easier for sure.
Yeah.
And I did do the balloon sinoplasty before
You had
as well.
surgery, yeah.
Yeah, and that didn't fix it.
And that's the thing. I mean, that wasn't the problem. I mean, and we see patients a lot of times where they've gone and talked about balloon sinuplasty, and I've done balloon sinuplasty. I do balloon sinuplasty in appropriate patients, but that really had very little or nothing to do with what your problem was. That's a sinus issue. You had a nasal issue, and they're different things. So, but yeah, I think it made a really big difference, and we'll show the pictures in a minute.
Yeah, and that's something we do in the consultation process. We talk to the patient. We usually get a CT scan just to see the whole picture, and then bring you back and then make a plan for surgery. And then we bring you back for a pre-op appointment, and once we choose the date, and we basically prepare everybody for surgery. And that's what we did with you, Lindsay.
Yeah, you guys made it very easy. The process was very easy.
Yeah. And I've been through it myself, so I'm a great person to talk to about it. Just the post-operative recovery, which is something we do at the pre-op as well.
Yeah, I mean, I think the recovery is reasonable. I mean, everybody's experience is a little bit different, but I do think that, I mean, a lot of patients say it's not as bad as they thought it was going to be, but I mean, again, it's definitely doable and definitely worth it.
Definitely worth it.
So
definitely worth it. Do you want to show the photos?
Yeah, let's show the photos again, and we'll let everybody see where we came from. Again, with the injury that she had, the nose was really crooked, and it was very narrow and not well supported, and that tended to collapse easily. When the nose is, most people notice noses for bad reasons. It's either crooked or too big, or there's something wrong about the nose when they notice it, and it distracts from the eyes, it distracts from the smile. And so we really try to make the nose look normal. And I think from that standpoint, I feel really good about what we were able to accomplish, especially given the history with the trauma and how it grew, and how all the issues that we dealt with the nose. I think it really, really came out nice. And again, you can really see how crooked it was and how the tip was very pinched, and the middle third of the nose was really narrow, and it tended to collapse easily, and all of those things that we had to work on to make it where it was much better balanced and work together. The challenge with the nose is that you can see 1 to 2 millimeters, which is a very small amount, is noticeable on the nose. And so the issues in the after picture, the minor abnormalities, you can see those. It's so much better than before, but that's one thing. You can see small abnormalities just right in the middle of the face, and everything is interconnected. I mean, so you make a change in one area, it can change what the other part looks like, and so all of those things go into making it really challenging and really taking a lot of focus and a lot of effort to get that type of improvement. But really nice improvement in the bridge of the nose, the tip of the nose. It just looks like it works together much better. And as you were saying, Lindsay, you're just not self-conscious.
Yes, it boosted my confidence for sure. And I would say I regret waiting so long to get it, but I don't, because I'm happy I got it with you, honestly.
Yeah, no, I appreciate that. And it would, again, I think we do see that sometimes when people have had surgery elsewhere, and it doesn't necessarily fix everything or whatever. And I do a reasonable amount of revision surgery as well. So I think that's really important, getting the right surgeon, whether it's me or somebody else. But I'm glad in our case, I'm glad it was me, and I'm glad I was able to do this for you.
Yeah, and I told you my most self-conscious areas too, and you listened. So
Yeah.
it was that pinched tip, and then there was like a bump on my right side that I really hated, that you fixed for me.
Well, let's go back and look at
That you see it. Yeah, you can see it there. That on my right nostril, you see that bump. I don't know why, but I just really hated that bump.
Yeah, and I don't necessarily have a pointer that I can show you, but yes. And you can see just there were a lot of contour issues in the befores. There was a lot
very like sharp.
Yeah.
Looking.
The tip was really, really pinched, and the sides
got worse the older I got.
Yeah. And that does do that. And especially, I mean, at your age, it's one thing, but, we get into your like 50s and 60s, that even gets much worse. I've certainly seen that where the cartilages get weaker as we get older. And so, even to your age, it had gotten weaker, and you said it had gotten worse, but it would just get worse after that. And a lot of times people will come in and they'll say, well, what if I don't do anything? And I say, well, it's probably going to get worse, unfortunately. So, but yeah, it's...
and my septum doesn't droop as much.
In the front.
It was starting to collapse. I felt like it was starting to collapse.
Yeah. And we, rotated up the tip just a little bit, and improved that. The skin between the nostrils there is called the columella, and that you had sort of a little bit of a hanging columella, so it was like stuck down a little bit in that area, and that is not as pronounced anymore either. But I think the biggest thing is it really brings out your eyes. Like your eyes look so much better because you just notice your eyes even more.
Looks great.
Yeah, and then this profile too just shows, again, don't have the hump, and the tip has better contours and that kind of thing. And then this was before, and this just shows what happened when you sniffed in and tried to breathe through your nose. It collapsed. It was very narrow and collapsed easily. And again, there was a lot that needed to be done to try to improve that. And then after, the nostrils are more symmetric, they're a little bit larger, they don't tend to collapse as easily, those sorts of things. So, I think this is a really good example. Like I said, I think it's the difficulty associated with it, and showing that, You know, it's not perfect. I mean, and I always tell people, you know, that's you know, what is perfection? It's almost impossible to get perfection, but the amount of improvement that we got is you know, is really significant and accomplished the goals that we had. So
It's one of the most challenging surgeries you do.
it is. I think it is the most challenging, and not as many people do it. I mean, you know, that's the thing. A lot of general plastic surgeons don't do it. A lot of ear, nose, and throat doctors don't really do it. And you know, mostly, I mean, I think the people that do the most and do it really probably the best job would be people that are both ENT and facial plastic surgeons, that have the functional and the cosmetic side to it. So.
And you've been doing this. It'll be, when this airs, it'll be your 27th
years
anniversary at the Medical Center Clinic.
That's right. So a lot of experience anyway. So
Started when he was 15, he said.
that's right. That's right.
15,
Thank you.
Doogie Howser.
That's right.
So your friends and family, what's the feedback from them?
They've all said it looks so much better, you know, because when you look in the mirror, you're like, you see it every day. You start to not notice, you know,
Yeah,
it just
yeah.
becomes normal.
It's good.
And we're a military family, so when I went back home and visited, everybody was like, oh, looks so good when they saw it in person.
Yeah.
Of course, they saw pictures, and they said that I looked like more confident too. My sister said so.
Yeah, that's really nice. And it is something you literally grew up with. So, you know, it's tough because you grew up with it your whole life, but now you don't have to worry about it anymore.
Yeah.
So
awesome. I think we're about to wrap it up, but you can call us at 484-FACE. That's 484-3223 to schedule a consultation with Dr. Derek Jones. And we look forward to hearing from you. Have a great night.
How's it up?